All right. Good evening. Welcome to Tuesday Together Talk. I'm Reverend Rebecca Burrow. I am founder and CEO of Building Reconciliation, Inclusion, Diversity, and Gender Equity. I am so excited for this evening. We have some wonderful guests that have come to join us on Tuesday Together Talk to share their stories and tell us about what it's like to live with COVID-19 and to recover from COVID-19. As you all know, this has been a conversation that I have been involved in probably since March, actually, when we first started hearing about COVID and how it was impacting our daily lives. I appreciate you all joining me on this evening. This conversation is so necessary because, as we all know, COVID-19 is on the rise in every state. No state is exempt. Around the world, COVID-19 is on the rise. And so even as we approach this holiday season, as we approach the flu season, there is no better time to have this conversation than right now. Knowledge is power. And so on this evening, what we plan to do is impart some knowledge into your lives as you prepare for this season, this holiday season. I know some of you are planning on traveling and some of you are planning these big Thanksgiving dinner and feasts with family from everywhere. So what we hope that we can do this evening is to make sure that we provide you with some information as you make your decisions, that you can make wise decisions for yourself and for your family. What complicates this virus is people are constantly asking, when is this going to be over? Everybody wants to know, when is COVID going to be over? But much of America refuse to do the most simple thing and make a simple temporary sacrifice, and that's putting on a mask. Putting on a mask and social distancing. And I like to say it this way. The rule is 6 feet and a mask, not 6 feet or a mask or 6 feet. We need for you to do both. It's a both and. And so what we want you to know this night is that we are here to hear your questions, but I want our guest conversationalists just to share their stories with you and let you know what their personal experiences have been and actually continues to be. My guest conversationalists for tonight, we have Lauren, we have Steve, and we have Andrea. All of them have unique stories related to their to COVID-19 and their experiences. If you all have not already unmuted yourself, please unmute yourself. And I'm sorry, Laverne. Laverne is Steve's fiance, and she is sitting next to him. So I'm sorry, Laverne. I did not forget about you. But we know that this is Steve's story, although Laverne has been there as his support. And we'll get more into Steve's story tonight. If you haven't already done so, I did provide a link to Steve's story earlier today, and it's on my personal Facebook page and on the business page. I'll also put it in the comments because I want you all later on to be able to have that information in addition to what he will share with us on tonight. So I come to know all three of these great, wonderful people in different ways. I'm going to start with Steve. Steve, why don't you tell us a little bit about yourself and what you do?
Okay, my name is Steve. I am a professional DJ. Um, I am a senior fiber optics technician. I do a lot of work for the government, different companies around the world. Of course, this is my fiance here, Laverne. That's it in a nutshell with me.
Okay, all right.
And
And Steve,
on top of
I can barely hear you. So are you all in the listening audience? Can you hear Steve okay? Let me know. If not, we'll
Yeah.
get his sound
okay,
worked out.
Can you hear me better now?
I can hear you better now. Thank you.
Okay.
Okay.
So again, I'm a senior fiber optics tech. I do fiber optics for the government and companies around the world. I'm a professional DJ, and also we just started nonprofit um, group called SAX to teach kids how to DJ, how to do web design, a number of things in the entertainment field.
Okay.
And of course, this is my fiance sitting right next to me.
All right. All right. Thank you, Steve.
All right.
Lauren, could you introduce
Yes.
yourself?
Hi, I am Lauren McCauley Kimbrough. I am a hairstylist and a salon owner. I also, my husband and I have bow tie business and boutique at Radiant Salon. And I'm also doing contact tracing for COVID-19. And I am a wife, I have children, and I am excited to be able to share with those what I have experienced during this journey so that we could possibly be a blessing to others.
Thank you, Lauren. Andrea, introduce yourself.
Hello, everyone. My name is Andrea Peaton. I work in public health. I also work, I am on the radio with Power Plug Radio, which is a Black-owned radio station here in Pinellas County. I have worked in public health for about 10 years now. Up until very recently, I was with the whole COVID team in this area. I'm also a mother of one and the godmother of several. And I am here to share my story to hope it can change some people's minds and it can also help to protect.
Thank you. One of the reasons why I asked the three of you to be here this evening, I wanted you all to share your perspective, but I also want to make sure that people don't think that only seniors are the ones that have to fight hard to recover from COVID. You all are younger folks. I think everybody on here is younger than me. So you're younger people that have really struggled to overcome this COVID-19. And then also, I wanted us to really think about as African Americans, what this disease is doing to our community, our businesses, and to our families. So Lauren, I'm going to start with you because you are one of the first people I knew that had contracted COVID. And I believe it was at the end of March when you called me and I could barely hear you speak. Your voice was so weak. And I remember you saying, Becca, as you call me, nobody else knew, I have the virus. And I was so afraid for you because your breathing was labored, and also I could feel that you were just in pain and struggling, and I could hear that through your voice. So I want you to share with the listeners tonight, what were your earlier symptoms, if you had symptoms, and what was that initial stage of COVID like for you?
Yes, the first, I would say it was, they closed salons down in March. I believe it was like the week of the 20th. And so I was working part-time at a healthcare facility. And I was very cautious because I would wear gloves even before the virus was even thought of. And so we weren't able to wear masks when it came about. Only the nurses could wear masks because they were afraid that we would frighten the residents. And so in the midst of that, I just always tried to make sure things were clean. Anyone that knows me knows I am a fanatic about keeping things clean and organized. And even in the midst of my caution, I discovered it was March of the 24th. I noticed that I had this strange feeling in my throat. But I was like, well, maybe it's just allergies. But I kept moving, but I just knew something was going on. And then someone had showed, was saying how the virus, a picture of a man that had this virus look in his throat. And they said it started there. And I'm like, wow, I hope that isn't me. And so that week, I just started cleaning and doing laundry and just organizing like I always do, but it was just different. It was almost like I was moving fast. But not knowing that after that, I was going to be on my back. So the 27th of March, I worked at the nursing facility because they had already closed the salons down in the city. So I said, I'll work overtime. I'll get some extra hours in. So I went in and they would take your temp when you would get to the job and to make sure that you didn't have a fever and things like that. So I started to work and I worked and I was getting off at 8 o'clock that night. Well, about 7:30, my legs felt like noodles. I got to the point I started to feel like I was out of breath and I was exhausted. And I'm like, where did this come from? Well, maybe I just been working this extra time, because the salons were closed. I put in like 3 extra days. And so when I left the job at 8 o'clock that night, I came home and I took some medicine. I'm like, I took some ibuprofen. I'm like, well, maybe I'm just tired and I'm feeling achy. Maybe I'm just exhausted. So that night I started having this severe pain shortly after I took the ibuprofen in my legs and my joints. So I woke up the next morning and I had a temp and I still was feeling worse. And so I said, I'm going to get tested. So I got online to get tested through Lilly. And so they called that following week. I was able to get authorization from my doctor. So I was down Saturday, Sunday, Monday, I went to get tested. I got my results back. But by then, the same day that I went to get tested, which was on that Tuesday, I sprayed some perfume on me because I'm like, I'm going to get tested. It's just that I couldn't smell it. And I'm like, wow, I can't smell. So I told my mom and I said, I'm just getting weaker and weaker. So I was able to get tested. By that Thursday, that was it. I couldn't breathe hardly. I would go from my bed to the bathroom and felt like I ran 4 miles. And then every day it seemed to have been a different symptom every day. So then I began to feel a little fearful because I'm like, this doesn't seem right. Like, Lord, am I going to make it? And so the aches got worse. I just began to feel lifeless. It was work to even just inhale and exhale. I started to have chest pain. And so my mom was asking me, are you having chest pains? I mean, she was calling me constantly, and my sister, and my daughter. And I'm like, no, but I was. Yeah. I didn't want them to be afraid. Yeah. Every symptom, I just was like, no, I'm okay. Yeah. But really, I wasn't. I didn't feel okay. Yeah. Well, then one day I was having such severe pain that they called the ambulance. So the ambulance came. And then I was like, okay, is this my last trip? And so even when I got to the doctor's office, to the hospital, it was frightening because I had to be alone. No one was there. My family, they were concerned. My daughter was freaking out, my son. And so they asked me how was my breathing.
I want you to hold on to that thought for a minute.
Sure.
I
Okay.
want to get into that fear. I'm
Yes.
going to hold on to that because that's important. I really need for people to grasp that the whole idea of fear around this virus is a real thing.
Mhm.
I'm going to move to Andrea. Andrea,
Sure.
now we had been working on a couple of coronavirus initiatives and doing some partnering work. And I remember hearing through our network of people that Andrea has COVID. And my concern for you was I knew that you also had some underlying health issues. So I want you to talk about how did you differentiate between the COVID symptoms and some of the, underlying health issues that you experience?
So yes, I do have some underlying health conditions. The major one is fibromyalgia.
Mhm.
So and with fibromyalgia, you have what is called flare-ups. So my COVID experience started very similar to Lauren. I was working from home and working in my office, and this particular day, I was home and I felt this scratchiness in the back of my throat. And immediately, all of the antennas went up. And then I said, you know what, don't overreact. I said, I'm gonna give it a minute. But by 2 o'clock that afternoon, it was still there. I made some calls and immediately went and got tested. My main concern, ironically, was not of me. My main concern was of my mother. My mother lives with me. She's 71 years old. You wouldn't know it. Everyone thinks she's my sister, but she's still 71 years old. So that was my main concern, was that I wasn't going to give this to her. So I hadn't been around her, luckily. And I put a mask on and went downstairs. And when she saw me with the mask on, she was like, okay, what's going on? And I said, well, my throat feels funny. I'm going to go get tested. So I went and got tested. I came home and immediately isolated myself. I was able to do that. I have a bathroom in my room. And most of the time she spends her time downstairs. So every day was a new symptom. Every day it got worse. It went from the throat to the body aches and to the eyes. The only way I could describe it, it just felt like someone took my eyeballs out, squeezed them, and put them back in my head. There's nothing is no way to help someone understand. And so every day it got worse. I have a very high tolerance for pain. Unfortunately, I am used to being in pain. I'm in pain almost every day, but this was pain on top of the regular pain. And unfortunately for me, the COVID then did trigger a flare up. So I was in the midst of both suffering from COVID and having a flare up. So that was a Thursday when I got tested. By the following Thursday, my test results had not come back. I actually got a phone call telling me that my test results had gotten contaminated and that I had to get retested, even though I knew I had it by this point, because it was the shortness of breath. It was the fever. The only thing that did not happen to me is I did not lose my sense of taste and smell. And I went and got tested. I drove myself. My mom isolated herself so I could get out of the house. And but by that afternoon, I was in so much pain. And I called my mother, and she was downstairs, I was upstairs. I was incoherent. She couldn't understand me, which then freaks her out. Yeah. So she called a very good friend of mine who is a nurse, and she immediately said she needs to go to the hospital. Yeah. And that's what I did. I went to the hospital. And the hospital, I didn't get fearful until the hospital. Wow. That's when I had to go to the hospital, and I didn't do the ambulance. My brother came and took me, and he couldn't go inside. I was alone. but he wouldn't leave, so he was out in the car in the parking lot, and that's when the fear set in, because I I was afraid that they were gonna put me on a respirator,
Okay.
and if I went on a respirator, I knew that that was gonna just be it.
Okay. That's a common denominator, that fear, and that's why I want to touch on that. But I want to hear Steve's story, because Steve, I learned about your story from that Facebook post that also was a news story on ABC 11 there in Raleigh, and your story really triggered something, because you were probably the first African American male I know that had such severe symptoms. So I want you to tell us your story. How did this all start for you?
Okay. Can everybody hear me?
We can hear you pretty good. Thank you.
Okay. Um, it all started for me. I actually went to the emergency room for I had a pain on the side of my neck, and I went for that, and they tried to tell me that I had a maybe a pinched nerve or a disc or something. But at the same time, my eyes was bothering me real bad. I have been
Mm,
complaining to her about my eyes for about 2 weeks.
wow.
I mean, my vision had got real blurry. I was using eye drops, but every time I was using eye drops, it was basically burning my eyes.
Mm, mm,
Um, so they gave me a COVID test that night. Um, 2 days later, it came back. It was on the 24th
mm,
of June that my test results came back positive. That night, when we actually found out that it was positive, I began to catch a bad fever. My body aches was bad. Um, it was just terrible.
mm.
But the thing about it, mine's only the pain with that only lasted 2 nights.
Wow.
After 2 nights, I was like, okay, if that's all it's gonna hit me with, I'm good. I can handle that, you know. Um, then I think it was like 4 days later, it started getting worse.
Mhm,
Um, I lost my appetite. I couldn't smell. I couldn't taste anything. And every time I would try to eat something, I had a bad pain in my chest.
mhm,
And I thought it was coming from what else? The Tylenol, the Tylenol that I was taking. Because I was taking, they just kept saying, take Tylenol,
mhm,
drink warm water.
mhm,
And of course, that's what I was trying to do. So I'm like, okay, maybe it's the Tylenol that's affecting my chest, making me feel so bad. And then came the fevers,
mhm.
sweats. So of course, at that point of time, I was just staying downstairs, and she wouldn't leave me. Of course, she was staying right there. I'm like, okay, I didn't want her to get it,
Yeah.
and so it had got to the point where I was so weak and I couldn't do anything, and she would come lay up next to me,
Mm,
and it was to the point where I felt like my life was leaving me. I
mm,
felt that twice. The second time, well, the first time, I actually jarred myself out of it. And she was like, babe, what's wrong? And I was like, nothing, I'm good. The second time when she came over and I was laying on her, I just felt a calm peace.
mhm.
And it's almost like she felt me stop breathing
Wow.
because we both jumped at the same time. And at that point in time, I said, okay, this is not good. I need to go. So she called the ambulance. They came. They took me to the ER. I stayed what 2 nights? Oh my, two nights. Um, that's when I found out I had pneumonia. Didn't
Mhm.
even know I had it. Luckily, it was not. It was viral pneumonia, not bacterial.
Okay.
The bacterial is when you go on the breathing
Mhm,
on the respirator. So I said, okay, well, I'm gonna, I'm gonna work this out. They sent me back home. When I came back home, I could barely walk.
mm.
I got I got worse. It was I don't know, it was like just coming out of there.
Wow.
My legs was weak. I could not walk. I had to be helped in the house. And then 4 days later, I was in the bathroom and she was standing to the door. All of a sudden, my speech was gone.
Wow.
I was having a TI mini stroke right then and I didn't know it. And she was like, babe, she was like, what's my name? Consciously, I could hear, understand
Mhm.
everything that she was saying, but I could not get it out,
Yeah.
and so I was like, okay, you need to call them. When they got here, my oxygen level it was low. It was under 90.
Mhm.
It was in the 80s, and they usually wanted them between the 93, 98
Mhm.
up there. So at that point of time, when I got to the hospital, they said, okay, we're gonna check him and everything. They gave me MRI and CAT scan, and what they were saying was I had a mini stroke, but they could not see anything.
Mm. Wow.
Okay. So while I was there the third day, I had another one,
Wow.
and it was that morning when the doctors actually came in and they saw what was going on. So they rushed me out.
Mm.
And it was the second one. They said, okay, he's having another stroke, a mini stroke of TIA. So the next day when the doctor actually came back in, he was like, we're not seeing any signs of it. So what we're going to do, we're going to check for a small spot on your brain. And if we can see it, we're going to treat it with steroids. And I was like, nah, I said, don't
Mhm.
steroids make this worse? And they was like, no, this will be especially for that.
Mhm.
And so I said, okay, I'm going to try to go through with that. They did it. They couldn't find a spot. But by this time I had went from 271 pounds to 240
Wow.
within 7 days.
Wow. Yeah.
Um,
Yeah.
yeah, then
Yeah.
they, 2 days later, they said, we're going to release you. It's nothing else that we can do. And I was like, what do you mean there's nothing else that you can do? They was like, is you gotta ride it out, because they said that the pneumonia was basically robbing me of everything.
Mhm.
The fever, the Tylenol, and that I was taking in it. Tylenol really wasn't doing, it was helping, but it was harming me at the same time
Mhm.
because it gave me an elevated liver
Mhm.
and
Yeah.
caused my
Now,
cholesterol to be
Steve,
thrown off.
at this point, had they already diagnosed you with COVID? And I'm asking that because I know of so many people that have gone into their doctors and have been told they have pneumonia, they have the flu, and never given a COVID test.
Yes, they had already diagnosed me with that.
Okay.
Yeah, before I went.
Yeah. Wow. Okay. So I want I really, as I'm listening to your stories, wow, I appreciate you all telling your stories, and but I hope that people can hear what really has happened during this time with you all, because this is painful to hear, and so I know it has to be all the more painful for you to have experienced. So, Lauren, I want to circle back to the fear, because you you mentioned that, and I've heard that as a common denominator in the three of your stories. So tell me what that fear, what that experience was like for you.
Um, I am the type of person that I'm always trying to find a solution to things.
Mhm.
And so in this scenario, when this situation happened, I realized that I had no control over my situation, and that it was going to require a lot of faith, even my fear. Um, and knowing that God was going to get me through one way or the other. And so the fear was just daily, not knowing what's to come,
Mhm.
what was going to happen next. Um, hearing the stories prior to me getting sick was frightening. And then I was concerned more so for my children and my family, because I was like, oh Lord, what are my kids gonna do? Or are you gonna get me through this, And being to the point of not being able to speak. I went for weeks. I couldn't talk to really people. My mom, they would touch base with me. People were leaving things on the porch and messages, but I didn't know. I can only remember certain things. But I remember being fearful. And like what Steve was saying about, there was a time, one night that I couldn't hardly breathe. And that next morning, I felt something be blown back into my body, like I had stopped breathing.
Wow.
It was like, and I went, and I could feel the air. It was like I was gasping. And then and I'm like, wow, did I stop breathing?
Mm-hmm.
And so the night before, I was thinking I wasn't going to be able to breathe anymore. I'm like, okay, this is probably almost it. And so I was afraid my son would walk in or knock and I was gone,
Mm-hmm.
And so the fear is just the unknown, not knowing what was next, every day something different. I remember the top of my head felt like mush. It ached to my skull and I could feel it. I didn't even have to touch it to feel the pain in my skull and my joints. I was hurting so bad that I could barely walk. And like Steve was saying, I went from 145 to 120. I lost so much weight. I was frail. You could see my shoulder bones.
Yeah.
So,
wow.
Yeah.
Andrea, what was your fear experience? And after we're going to talk about this, I then want to talk about the ongoing trauma, but right now I just want you to focus on what that fear was like for you during that time.
On that following Thursday, when the pain got to be so bad, the only way I can explain the headache was it felt like my brain was trying to push its way out of my skull. And when they told me I had to go to the hospital, and I knew that no one could go in with me. So I get there and they've turned the hallways into waiting rooms. That's how many people. So they're keeping the COVID people away, and they kind of just stuck us over there, and that was it. I literally sat in the lobby of that emergency room for almost 8 hours before they got me into a room. All of us were positive. All of the people who were sitting with me ended up being positive. All of us except for one was African American. And I just kept looking around and I'm like, okay, is this going to be this outcome for me? Am I going to go in here? Are they going to put me on a respirator? And am I not going to be able to see anybody? Am I not going to be able to say goodbye to anyone? My son was getting married soon. Am I not going to see, my child get married? And it was just that fear, because doing the work that I had been doing leading up to the mid part of June when I got sick, it was dealing with COVID patients, doing partly the contact tracing and helping with some other things. And I would see those names, and then I would come in the next day and that name would say deceased. And my fear was that my name was going to go up on that board, and
Wow.
that was what's going to happen to me, and it was scary. And then on top of that, to have to be by yourself, Is that's just it's nothing that I would want anyone to have to go through.
Yeah. Yeah. Now, Steve, I read a bit about what your experience was, and I want, as you talk about your experience being afraid, I want you now to transition us and talk about also the ongoing trauma associated with COVID-19.
Okay. Being afraid, what I went through actually in the hospital, I was there. I was in my own room, of course, and I'm thinking the only reason was because the ambulance brought me there.
Mm,
Um, but it was COVID patients all around. When they turn the lights out at night, you hear patients crying, screaming. You're trying to sleep. You're waking up in the middle of the night with sweats, and you can't go back to sleep. Your dreams are just, it's almost like you're having dreams of seeing COVID in your mind and it's
mm,
attacking
mm,
you. The thing about it, I was afraid even when I left from there because I still could not walk. I couldn't talk. I mean, I was a mess, and it was nothing that they could do. Coming home, I'm thinking coming home was the best thing for me at that point of time. Um, I was scared to be around my family, still scared to be around her. Um, they, I was supposed to come home with a walker, didn't get a walker, so the next day when she was leaving out to go get a walker from the hospital, my brother-in-law had sent one from New York.
wow.
So it was like blessings was starting to happen. So I was like, well, maybe this is the best thing. Whether I'm gonna make it or not, I didn't know. I
Mhm,
didn't know whether another stroke was gonna come or whether I was gonna be able to walk again. So after being here a few days, and drinking stuff and feeling like I'm getting better, I was still having my ups and downs, but the ongoing problems came not being able to sleep at night.
yeah.
Still, right now, I have to sleep with a nightlight on,
Yeah.
or the TV has to be on. Um, at first, I think for like the first 3 weeks I was home, I was up all night. I had to listen to music all night, something that would keep me calm and pray.
Mhm,
You know, um, my memory right now is not as sharp as it used to be,
mhm,
and that's coming from the COVID as well.
mhm,
Um, every now and then, she'll have to remind me of something, or we'll write it down. You know, it's getting better, but the effects of that is terrible.
right.
My lungs are still in the healing process. They said it will at least be 4 to 6 months before my lungs build back up. I had to go through physical therapy and speech therapy. And the speech therapist, she gave me the she gave me the best information
Mm,
that was better than what the doctors gave me, because I'm thinking the whole while that these TIAs, these strokes that they said that I had, but they couldn't find them. But what she told me, she said, she said, it's the pneumonia robbing you of everything. She said, there's so many muscles in your neck and in your jaws that you need to keep moving, to keep speaking.
mhm.
And as time went on, I would notice that when I got tired, if I just laid down for a little bit, my speech would come back.
Wow.
So I mean, it's every now and then I still have to pace myself, um, just to keep my speech in order, just to maintain my breathing. I'm able now to we actually walk maybe about 2 miles on the weekends. We walk around here, we do a little exercise. So I'm able to start building all this back up because I never had any underlying conditions. But as of now, with this, I mean, it's an ongoing thing, but I feel like with prayer, I'm going to get through it and get over it. Yeah.
Steve, one of the questions we had was, did you have any underlying conditions? Did you have any underlying health issues?
No,
Okay.
I basically was a it was a gym rat.
Yeah. Okay.
I love to stay in the gym, so I had no underlying conditions.
Mhm.
The thing about it, um, how I know how I have a feeling of what they told me and how I know I caught COVID.
Mhm.
It was I would protect myself with my mask going, in a gas station or a store. But when I feel like when I caught COVID, it was through my eyes.
Mhm.
Not by me touching my face, touching my eyes, but walking into a store or a gas station, somebody could have coughed or sneezed
Mhm.
and everything came down and I walked in the midst of it because my eyes was the first thing that started feeling so terrible. And
Mhm.
then when I actually went to the actually when I was before I came home the second time, they told me, they said that is probably how you got it through your
Wow.
eyes.
Wow. Lauren, now I remember making some phone calls to Ariel, your daughter, to
Yes.
check on you because it got to a point where there was no way you could communicate. Um, I remember hearing the fear in her voice, but I also
Yes.
remember she was afraid for your son as well because he was there. So,
Yes.
so I understand that perspective of you being afraid for your family, and as a mom being afraid of, am I leaving my children? Um, but
Yes.
you have shared with me some of the other trauma that has been associated with COVID and some of the ongoing fear that has manifested itself. I want you to share with the listeners what that has been like for you.
Yes. It's been very challenging. I went through, like Steve was saying, about when you go to sleep, fearful.
Mhm.
I remember being so weak that I couldn't stay awake. And then I got to the point where I became so fearful that I was trying not to sleep, even in my sleepiness. And so as time have gone on, I'm asthmatic, so I've had asthma, but I hadn't had really any issues with my
Mhm.
asthma until COVID.
Mhm.
And now I am I have to have treatments, albuterol treatments every 3 to 4 hours. I was just in the emergency room last week, well, 2 weeks ago, because I couldn't hardly breathe. And I contracted COVID back in March. So I'm still dealing with shortness of breath, having to do albuterol treatments. I'm on medicine for severe muscle pain. I have muscle spasms and vertigo. I get dizzy very easily. I started dealing with severe anemia. So that was part of my muscle pain. Um, Forgetfulness. I do forget. Actually, about a month ago, I started my car and let the garage. Well, guess I was leaving the house to go somewhere. I don't remember. And I started my car and let the garage down. And so my car ran in the garage for 2 hours. Had no clue why that happened. And then I remembered. And so I'm dealing with the brain fogginess. I get very forgetful. If I'm writing, sometimes I know words. I'll write them and write them wrong. I was trying to write the word people one day, and I know how to spell people, but I was spelling it P-E-P-L-E. Just, and I'm like, this isn't right.
Mhm.
Just strange things like that. Um, my nails had turned black. Was dealing with losing a nail due to COVID. Um, so it's been ongoing things. My family's very patient with me.
Yeah.
My husband, he tells me about sticky notes, just making sure I put sticky notes. My mom, they're all very supportive. My children, my sister, with knowing that I have moments. There's times that I can be talking and I just get a brain freeze, like not normal. It's different. It's a different thing. Almost like, what was I just thinking about, or what was I about to say? Or names. I have clients at work and I may forget my client's name, and I'm thinking, and I don't share it with them, but it's like I'm processing, like, what is her name? And I've been doing her for years. So I have moments like that. So it's unusual. It's an experience I've never had, and I want people to know it's real.
Yeah. Yeah.
It's real.
Wow.
Yeah.
Andrea, this fear and the ongoing trauma associated with COVID. I want you to speak to your own experience, but I also want you to speak to what you have seen in the community when it comes to that ongoing trauma.
The crazy thing is that with my fibromyalgia, I don't know if some of these lingering effects are actually the fibromyalgia or if it's the COVID. I suffer from brain fog, but I have noticed it more than usual. And I was diagnosed with fibromyalgia back in 2012, 2013. So I can tell a difference in the uptick of that. The swelling of my joints, it happens a little bit more, and the swelling is different, and it is happening in different places than I'm used to. But the big thing that I do know is, if in fact a lingering effect, are the chest pains. So I have severe chest pains that freaked me out, and immediately called my doctor. So I will be going for, they did an EKG, and now they're going to do an echocardiogram, because one of the things is that they're finding it has damaged people's hearts. It has damaged their lungs. They don't know if this is something that people will be able to recover from, because all of this is new. And that's what we're seeing in the community. The effects are different. We're hearing and seeing different people telling us different things. So it's not cookie cutter. COVID is definitely not cookie cutter. It affects so many different people, so many different ways, to the point of, when I was in the hospital, luckily I only stayed a day, because they told me they were sending me home because I was a mild case. And I remember thinking, if this is mild, I don't even want to know what is anything worse than this, you know? And I felt weird, because it was the relief of, okay, I get to go home, but then it was also, but what if I get home and something happens? You know, my mom doesn't know what to do, and I wouldn't even want her to come in the room to do it. And I remember, after coming back from the hospital, every night when I went to sleep, it was, okay, I hope I wake up in the morning. You know, because laying down, it was harder to breathe. You know, I sometimes I couldn't sleep, and then when I could sleep, I would sleep so hard because my body was so exhausted.
Yeah.
And this is what you're hearing. We can't narrow it down to any one thing. Yeah. You have people who are severe, and then you have people who have no symptoms whatsoever. And the only reason why they know that they are COVID positive is because either they went to just go get tested, or someone that was around them or someone in their household was tested, and then they're asymptomatic. And it's our asymptomatic people who concern me the most, because these are people who don't know they're sick, you know. And the one thing that we have this spread is because, as you said in the beginning, we don't have people wearing masks. They come up with all of these reasons not to wear a mask. And but, oh, I feel fine. Oh, I don't have a fever. Well, you don't have to have any of those symptoms, in order to be COVID positive. So we get a lot of phone calls about well, what should I look for? Especially people who have had it and they're like, okay, can I catch it again? So for a very long time, we did not know the answer to that.
Yeah.
Then it came out that you probably would have antibodies for about 3 months or so.
Mm-hmm.
But information that has been given to me recently is that in this new wave of COVID that we are seeing here in Florida and all over the country, you're starting to see people who were infected in the earlier part of the year coming down with it a second time. The reason why they know this is because they tested positive, then they tested negative, and now they're testing positive again all of these months later. So it's hard to speak to the effects because they're so different. You're hearing that people are having constant headaches. You know, I see an uptick in my headaches. I have the chest pains. You know, you have people, it has aggravated their asthma to a point where they're on treatments, and it's just concerning. And one of the things that I want to bring up is that one of the things working in public health, one of the things that went through my head sitting in that emergency room with all of these other people of color was, am I going to get the right health care because of the color of my skin?
Yeah.
You know, and that was the public health part of me. And to say, because I know that there were many people all over this country, Black and brown people, who probably did not get the care that they should have because of the color of their skin. And that's something that's very concerning too.
Yeah, that's interesting, because what my experience has been when talking with people that have been told, oh, you have the flu or you have pneumonia, and send them on home. Always, my first question is, did they test you for COVID? And the response typically has been no. And I hope my sister don't mind me blasting her on this evening, but I remember I called her one day and she answered the phone. I was like, what's wrong with you? She said, I have the flu. I said, did they test you for COVID? She said, no. I said, please, no matter what, go today and get a COVID test. And she went that same day to get a COVID test, and they sent her to the hospital because her oxygen sats were so low, and she stayed in the hospital for a little while. So that is also a concern I have as we move into this flu season. Yes. Where it's going to become more common for people just to blow it off and say, oh, it's the flu, and send you home. So I want you all, Steve, I want to start with you. How can people advocate for themselves and tell their doctors, look, give me a COVID test, or what can they do? And I know you're in North Carolina, so the system there is going to be different than the one in Florida and the one in Indiana. But what has your experience been, and what is the best approach for people to ensure that they get a COVID test?
I think the best approach for people here, just tell them, I've been around someone that's been exposed.
Okay.
You know, because if you go in, if they'll ask you, have you had a fever? Have you had this? Have you had that? The first thing they're going to say, okay, well, we're not going to test you.
Mm-hmm.
You know, and that's the thing. You have to tell them, I've been around someone that's been exposed to COVID, and I'm starting to feel this way.
Mm-hmm.
I mean, it's a shame that we have to somewhat tell a fib to get that.
Yeah.
But if it's going to save your life, you got to do what you got to do at that point in time.
Yeah. Lauren, what do you recommend for folks that are in the Midwest?
I believe that they would need to tell someone they have been exposed. Mm-hmm. Tell the doctor you've been exposed. Tell them if you're having symptoms, things like that, because a lot of times they, like you said, from my understanding, they're not giving tests, and right. They're just sending people home saying just quarantine. Mm-hmm. And so I think sometimes you just want to know, just know. You just want to know, even if you're going to be in isolation, mm-hmm. You just want to know. So that's the only thing I can think of that will encourage them to test you.
Mhm.
And then get on the websites and see who's giving these tests, free tests. Like I said, I had a doctor, my doctor sent a prescription to Eli Lilly for me to be tested because I had made it known that I was having symptoms. And so they were willing to do it. So that was a good thing, because otherwise, from my understanding, they're not just testing you.
Right. Yeah. Andrea, what is your suggestion?
So things are just a little bit different here in the state of Florida for several reasons.
Yeah.
We are now third in the number of deaths of all of the states. And Florida's just hard-headed is the easiest way to say it. But one of the good things about this is that there are a lot of drive-through testing that they don't question. You pull up, you fill out the paperwork, and they test you. They're testing both symptomatic and asymptomatic. Now, if you don't want to do the drive-through, or you don't feel well enough to drive yourself to a drive-through, then if you go to an emergency room, you know, I'm going to have to say the same thing that Lauren and Steve is saying. Tell them that you've been exposed to someone who was positive. You know, probably were, if you had to be out. And that's the crazy part about this, is that we've probably been exposed. I still don't know where I got mine from. I was doing nothing but home, and I would go to the grocery store for my mother and my grandparents, and I would go to work, and that was it. So somewhere in there, I got it. And I probably will never know, who I got it from, but that's the most important thing. Be insistent. If they're trying to turn you away at this point, it is not going to hurt anything to get tested. If you have insurance, they're going to charge your insurance. If you don't have insurance, they still can test you. Just be insistent. You have to advocate for yourself, because you're alone. You're going to end up in this car, because they tell you don't come with anybody else if you're driving. If you go into an emergency room, they're not going to allow anyone to come in with you. So through the unfortunate pain, or however you're feeling, or just even if it's concern, you have to advocate for yourself, because no one else will.
So you all heard that, you have to, I've been exposed, or whatever it takes for you to get tested. I remember when I tried to set up some testing, in Florida, they have where you could set it up online, and it was like 3 weeks out. And then at that point they were saying, and it'll be another 10 days probably before you get your results back. I was like, well, if I have COVID by then, hopefully I would be okay. But who would I have exposed myself to, at that point? I finally was able to go in and get a test, and I did test negative, but I went because although I did not feel like I had symptoms or anything, at least consistent symptoms, I had, a little throat ache, and I know I've been in and out the grocery stores and different things. And I wanted to make sure that I was protecting my husband also. So I felt it was important to get the test. It was, for those of you that are afraid and say that it hurts and all that, what it did for me, it opened up my sinuses, for a brief moment. So, but I would rather experience that moment of pain than to have to endure knowing that I've made somebody in my family or one of my loved ones sick. So it's important you all make sure that you get tested, and no matter where you live, you can contact your local health department, and they will definitely let you know where you can get tested. So with that, I want to transition real quick into, I want to talk about how this has impacted your businesses. For Lauren, you are a business owner. You have owned Radiant Salon for, good Lord, it's been about 20 years or something. It's been a long time. But all of a sudden you're sick, and that means you can't go to work. You can't operate your business. You can't manage your business. Talk to us about how this has impacted your business.
It's impacted it a great deal. The difference is from March, the end of March until I think they opened salons up June 15th. Well, by June 15th, I still wasn't able to go back full-fledged at the salon. And I'm still not full-fledged. I work maybe 2 days a week, maybe a client here and there, because I do my other job at home. I'm at home, I'm in the safety of my home. But it has impacted a lot of clients have been fearful to come back out into the community because of the cases and the way things are. And so a lot of the ladies that work at the salon, they're working. And so I only see them a couple times a week. So it seems to be, I think everyone, their clients aren't coming like it was, but it's enough. But it's impact me because my clientele, I'm not able to assist those clients that I at one time I was able to assist them all the time. But I only have a few that I do here and there. But it took a while because I didn't work for so long. And so luckily I have the support of my family and my husband and different ones, but it's impacted as far as the clientele. But I have stylists at my salon and we all work together. And so they're able to be back at work, which keeps the business going. But I'm not sure what's coming next because, the cases from what I see on the news are rising again. So I've been, this was good, a good opportunity for me to work from home. So I'm doing that full time, working at home in my office. And it keeps me from having to, because going out to the community, I have to wear my mask. By having the asthma and these coughing attacks and these issues with my lungs, and some anxiety behind it when I'm out, just period, to COVID, it starts getting really difficult for me to breathe after a while wearing the mask. So couple hours, 2 or 3 at the salon, couple days a week is about all I can do right now anyway.
Yeah. Wow.
So, but things are moving forward. Yeah.
Steve, I know that you also are a business owner. How has this impacted your business?
It has tore my business up. Um, usually by this time of the year, oh my goodness, it's no telling how many events that I would have done by now. Um, and I'm just now getting back into it. But it's on a smaller scale, maybe 20 people or so, everybody mask and everything else. But the thing is, even with me being a business owner, um, it's still problems because I still have, as young lady said, Lauren said, I still have anxiety. I have attacks. I mean, frequent where my heart rate is beating so rapidly. I have to calm myself down. I still don't drive. I mean, she drives everywhere now. Every now and then I will try it, but I will have to pull over because it's a fear that comes over me. It's really hard to explain what's happening, but I have to pull over. I have to breathe, or I have to drink something to try and calm myself. Um, but so far as the business, it's not good right now. Eventually it'll pick back up, but with the new business that we started, the academy, hopefully that'll come into play real good next year. But it's still gonna be with social distancing. right now we're not even going to get an office building because of having to have the kids around each other.
Yeah.
So it's going to be very difficult now.
Yeah.
But other than that, my other job that I actually do, because I am essential worker with that job, because we do a lot of government projects also. Um, they don't have a problem if I need to get off, stay home, or whatever the case. And they work with me in every way they can.
Yeah. Um, Paula asked, can this be considered a disability, PTSD? And Paula, based on what I've read from Stephen, I'm gonna let him talk a little more about that. That is one of the ongoing challenges, is that there is the PTSD, and I believe that they're in the research triangle. They're starting to do some studying around some research around the effects, long-term effects of COVID, including the psychological and the PTSD. Steve, you want to speak to what Paula is asking?
Yeah. Um, so far as it being a disability, they have to do more research on it as of right now. Um, and then even to be classified for that, you're going to have to see a doctor to say, okay, well, this is what he or she is experiencing, and it falls in the line of PTSD. But being that there are no programs out there right now for anyone that has caught COVID, it's just no help for us, period. it it's almost like everyone that has caught COVID, you have to build a community for yourself to try to help each other. Hopefully around here soon within this area they will have a program to help us, and when they do, I'm going to spread it.
Yeah.
I'm going to
Okay.
spread it.
Yeah. Thank you, Steve.
Yeah.
Andrea, I know that you have a full-time work in public health, but you also are a business owner.
Yes.
So how has this impacted your business?
So I have several things that I do on the side. I make jewelry, and so my key place to be able to sell my jewelry was mainly at festivals, which of course we don't do anymore. So it was trying to learn something new to still be able to do that virtually. So I'm working on a project to be able to do sales of the jewelry virtually. As far as the radio station was concerned, there was a decision made very early on, because of platforms like Zoom. We were able to continue the radio station. The music, of course, is 24/7, but the shows that we had, we converted over to a Zoom Facebook platform. So that was it allowed us to continue. And as far as my full-time job in public health is concerned, I was blessed enough to not have to worry about missing a day. And when I did miss those days, there was um, there was a certain amount of leave that was given to the people who worked with me, that allowed us not to deplenish any sick leave or annual leave that we already had. So that was a blessing. But the thing about it was is you going to work every day, it
Mhm.
was like, wow, it only took me 5 minutes to get to work. Why? Because there was no one on the road. And then it clicked in the back of your head. That's because all of these people are at home,
Mhm.
and not all of them have that ability to be able to work from home and continue to make a living. So I know that for many of the first responders, the essential workers, we were lucky enough to be able to continue to do that. It's what we call the new normal now. We have to learn how to function in this new world. I have people who ask me all the time, well, when is it going to get back to normal? It is never going to be the way it used to be, and people need to grasp that there's going to be a new normal, and we're going to have to learn to live in this world, even when COVID is gone, because it will be gone one day. But the lingering effects will always sit with us.
Right.
So that's something that we're going to have to learn to live with.
Well, I'm gonna say this real quick, insert. I saw Laverne smile when Andrea said something about jewelry making. I saw Lauren smile. So maybe we have a collaboration or a partnership going on, because all three of you make jewelry. So we'll have that discussion after after this conversation. Maybe we can get some building reconciliation, inclusion, diversity, and gender equity jewelry.
Okay.
But I so appreciate everything you all said. And Andrea, what you just talked about concerning the what we call in the healthcare world, the social determinants of health, which are all those things that create health disparities, and usually not helpful for African American or brown people, brown communities. Whether it's the economic divide, the education divide, the health outcomes divide. We are already at a place where we are working from behind, trying to catch up and create access to healthcare and equity in healthcare, create equity in our economic systems, and to deconstruct systemic racism. All of those things are impacting our community, which is why COVID has really been detrimental to our communities. And I want people to know this evening that you have to do your part to look out for your neighbor, especially us Christian folks that always want to talk about, who is our neighbor. Everybody's our neighbor. Put a mask on it.
Yes.
Practice social distance. Remember, social distancing is 6 feet at a minimum. We would really prefer that you do more than 6 feet, because that will help. We know that this thing spreads right through the air. That helps. And when you have a mask on and the other person has a mask on, and you have 6 to 9 feet or 10 feet between you, then the opportunities for COVID spreading are mitigated. So I want us to be very wise and to do our part. If you really are ready to get back to, life as usual, Thanksgiving with family and Christmas with family and all that stuff. If you're ready to get back to church and at your jobs and hanging out with your friends and all that stuff, then do what it takes right now in order to get back to what we call normal life. Lori says, please wear a mask. Thank you, Lori. I appreciate that. And before we go, I want you all to share, Lauren, I know that you are a contact tracer now. And I appreciate you taking what was a very difficult situation and finding a place where you can be helpful. So I want you all to speak to what you are doing now and what you want the people to know going forward, how they can be helpful in mitigating COVID. So Lauren, I want to start with you.
What I'm doing now is helping those that have been tested positive, and those that have been close to them, have been exposed. And so what I try to do is I want them to know they're not alone. There's times I say, well, I understand, I've had that back in March, things like that. So because sometimes you want to know that people know they can relate to what you've been through. And so I just want those out there to know is that you're not alone. There are others that are going through what you've gone through. And sometimes you may go to a doctor and they may act as though you're insane, but You know what you've experienced and what you're going through. And there's still people that don't believe in COVID-19. So just know that it's real. We are living witnesses of that. And um, everyone's experience is different, but it's still somewhat the same in the journey, you know. There may be a symptom that was similar, you know, and you just want to know that someone can relate. And like, I believe, I don't know if Andrea said it or something about coming together, having our own team, people knowing that there are others that have experienced this the same as you. And so I want people to know, wear your mask. And like Rebecca said, practicing social distancing, wearing your mask, and try to avoid the huge gatherings. I'm seeing that is where a lot of cases are taking place. People are still wanting to live life as usual, but we are in a different time, and we can't right now. We have to do the things that's needed, the mask and practicing social distancing, and not being out in these events that are taking place, because you are taking a chance. There's a huge risk in becoming ill, and you don't know how it may affect you. I feel like I've always been a healthy person. And sometimes I may look at myself in the mirror and say, you're the same person. You know, you have this going on and that going on. And what happened to that person that didn't have all this, you know? So I just say our journey and our experience is not just for us, it's for us to be a blessing to others and to share and come together in unity.
Yeah.
And know that one day things are going to get better.
Yeah.
It's just we have to do the things that we have to do now to get to that.
Lauren, I so appreciate you telling your story. I know that I've known you for years, but that didn't mean that you had to, you know, be a part of Tuesday Together Talk and be willing to tell your story. So I appreciate so much hearing it. There's some things that I did not know that you had gone through. And I'm so thankful for where you are today, and I do pray that God continues to heal you and restore you back 100%. So I thank you so much for telling your story. Steve, what do you want people to know? And and I know that you have talked about bringing awareness, but what do you want people to know?
People need to know that not only wearing your mask helps protect you, social distancing, not being in large crowds. You, we have to keep preaching that day by day until they listen. Um, Even when we have to be cautious, even when we go out in public with people that smoke. Blowing smoke in the air, and we're walking through the smoke. We don't know what we're inhaling at that point in time. So we have to be very aware. But the one thing my father told me, he said, you know what? He said, you're my only son. He said, you're going to make it through this, and you're going to be a walking testimony.
Yeah.
So I'm looking at three people right now on the screen that we are walking testimonies that
Yes.
we have to keep teaching and preaching to those that haven't been through it, and let them know that this is one experience that they do not want to deal with.
Yeah. Yeah.
I mean, we are very lucky to still be here. And even though all three of us, we're up here talking about it, it's some stuff that we go through that we still can't explain because it's just that hard.
Yeah.
And the only thing we can do is to keep praying about it.
Yeah.
I'm sitting here, I'm trying not to get emotional because I know what I went through. I know what I put. She went through, my family. It's hard not to get emotional sometimes when you make it through situations like this.
Yes.
And you say to yourself, I made it through that, and I'm going to make it through what I'm still going through. So,
Yeah. Laverne,
Yes, ma'am.
what do you want people to know?
Well, people need to take this COVID-19 seriously. Is regardless of those who don't believe in wearing masks, those that just don't believe this COVID is real. You're looking at three people, as he said earlier, that still dealing with lingering health issues and trying to make it. And
Yeah.
there's so many other people in this world that's dealing with it who have lost loved ones. I've
Yeah.
lost at least two people, close friends who have passed away. So they're here to be a living testimony for others. So I'm glad you had this platform to be able to tell their story, them to be able to tell their story.
Yes.
So I just hope that people continue to take this virus seriously. And on top of that, like you said earlier, the flu is coming as well. So we just got to be vigilant and protecting ourselves and others.
Yeah. Yeah. Steve and Laverne, thank you so much for spending this Tuesday together talk with me. I so appreciate your being willing to be vulnerable, to share your story. Um, I know I have two women also that I'm thankful that they're here, but I'm glad that we're able to hear this also from a male's perspective. Um, I do pray that God continue to heal you and restore you 100% as well. And that you all continue to bring awareness, and we'll do whatever we can. You know, this doesn't have to be our last conversation, um, because we know that at the rate of things, things are getting worse before they get better. So I think we have to keep this before the people, and then even after we come through, you know, the other side with vaccine and all that, we're going to need some support groups and different things for people. So we're going to have to advocate for people. So thank you both. Um, Andrea,
Yes, ma'am.
what do you want the people to know?
Um, I'm gonna share two quick stories, and then I'm gonna do my up on the I'm gonna get up on my high horse and talk a minute. But I want to share two stories. Unfortunately, they're sad stories, but people need to understand the realness of COVID. My very new sister-in-law, she lost both of her step grandparents. The sister, the daughter of the grandparents, her auntie, went to take care of her parents because she didn't want a stranger in the house, not knowing what COVID was. Unfortunately, she was asymptomatic. She gave it to both of her parents, and both of her parents died within a week of each other. And just this past week, a very good friend of mine was diagnosed with COVID and went into the hospital. And so was his brother, and so was his brother-in-law. He lost his brother and his brother-in-law within 24 hours of each other from COVID. And the same day he was released from the hospital, his sister got rushed to the hospital because she could not breathe. Mm. This is the reality of the world that we live in. And we could probably sit here for another hour and talk about what has caused this reality, but we already know what has caused it. And what we need to do is step outside of ourselves and realize that this world does not revolve around just me or just any one individual person. We have to come together as a group in order to heal this world. Yes. You know, you don't get your hair cut for 2 months. Okay. But if that means that 248,000 people did not have to die, then you don't get your hair cut. Yeah. You know, it's just, you don't go to the club. You don't do so many things. But one thing that you can do, other than wearing your mask and social distancing, is you can get your flu shot. We are in the midst of what they are starting to call a twindemic, meaning that we are going to be dealing with COVID, and we're going to be dealing with the flu. And here's the part about it: when it comes to Black and brown people, people over the age of 65, people with underlying health conditions, flu hits those same people that it hits COVID, that COVID hits. And we're going to run out of beds in a minute. Our flu season doesn't really hit until January. So usually we see our numbers go up in the United States January, February, and then it starts tapering off in March. You need to get a flu shot. If you're over the age of 65, please get a high dose flu shot. If you live here in the state of Florida, you can go to any health department, you can go to any CVS, Walgreens, any of those places and get the flu shot. I get my flu shot every year. I got my flu shot as soon as I possibly could this year, because I know that I cannot deal with both flu and COVID at the same time. And a lot of questions is can you be co-infected? Yes, you can. So if you think it was rough going through just COVID, imagine the flu on top of that. So please, you can't get the flu from the flu shot. I hear that all the time working in immunizations. You cannot get the flu from the flu shot. It is a dead version of the flu. Okay, so please go get that flu shot, because it takes at least 2 weeks for it to build up your immunity. And we want to be able to keep people as healthy as possible. And if you have a weakened immune system from the flu, then you have a good chance of being more susceptible to COVID. I need people to think outside of their bubble and realize that we live in a world with millions of people, and we're seeing rises in COVID all over the world, but we're seeing a crazy rise here in the United States. We have been breaking records every day. You know, and be prepared, because one of the things that President-elect Biden is talking about is a shutdown of the country. But we know that that works. But if it's done the right way, we will all survive this, not only for our health, but financially also. So please just think outside of yourself. That's the only thing that I can ask.
I want to thank you, Andrea, for being a part of this discussion and sharing your story also. And of course, I pray for your 100% healing as well and recovery. You guys had just a few questions, and I kind of hit on those. I think your stories were so engaging that people weren't really, so concerned about the questions, but there were a couple. One was, Andrea, someone wanted to know, how was your mother? And to know whether your mother contracted COVID or not. And then another question was, does COVID come in stages? And so I'm going to let you respond about your mom, and then I'm gonna let whoever wants to grab that coming in stages question, and then we'll go ahead and call it an evening after that.
So if you couldn't hear her, that was her singing in the background downstairs. My mother's doing fine. It's been difficult for all of us. I have not hugged my mother since March, and I live in the same house with her. And I realized that I'm a touchy-feely person, and this is not working well for me, but it's about her, not about me. So she's doing well. She's a very active person. She was starting to venture back out into the community, but when these numbers went up, she was like, I'm done. I'm not doing that anymore. Yeah. And really quick, the other part of the question, could you repeat it again? Because I was going to give my little part in it.
They were asking, do COVID come in stages?
So one of the things that we have found out about COVID, and Steve kind of spoke to this when he was sharing his story. There have been people who have been diagnosed with COVID and they get it, and then it seems to get better, and sometimes days or weeks it comes back. And when it comes back even worse than it was when you first initially got infected with it. That does not happen to everyone. I didn't have that where it came back. I just had the long lingering fatigue afterwards. But yes, it can come where you get the symptoms and then all of a sudden you feel better for a little while and then it just comes back and it hits you again.
Yeah, yeah. Lauren or Steve, do you all want to speak to that before we call it an evening? I've kept you all way past the time that I specified. I apologize.
Yes, it is one of the most manipulative viruses, disease that you ever want to meet. When I tell you, you'll feel like, oh, I'm getting better. And then all of a sudden you feel like a Mack truck ran over you. It's like you'll start being able to breathe better. And then I would feel like someone 600 pounds is sitting on my chest 2 days later. Like, I thought I was getting better. And it does. It's very deceitful. It's very deceitful.
Wow.
So because I was thinking, okay, just a couple weeks ago, I started not feeling well. And I'm like, okay, the shortness of breath is coming back more often. Okay, what's going on, you know? And then I got to the point I was wheezing so bad and feeling like, and then the left side of my chest, I'm like, is it my heart? It's hurting. You know, my chest started hurting real bad. I said, I got to get to the hospital. This is serious. So I get to the hospital and they did the x-ray and that's when they said you have to, they were concerned because the wheezing was so, you could hear it. They could hear it. And so it does. It seems to come in stages. You'll gradually have a symptom and then, well, that's how it started out. If that's what they're saying about the stages. First, I had the funny feeling in my throat. Then I started feeling weak, like I was going to collapse at work. Then once I got home and took a bath and got ready for bed, the next morning I started having pain and then the headache. And then every day it was something bad. And then as you get weeks go, you're like, okay, I'm starting to feel better. And then 2 days later, you feel like you're back where you started. So yes.
Yeah. Wow. Wow. Steve, did you have anything you want to add?
Also, they're doing a study now here in the Triangle where they're saying that it could be your blood type also.
Yeah.
You know, different blood types, COVID could affect you in different ways. It's just like her, she tested negative 3 times after being there for me 24/7. I had a friend to come over who was a pastor, Ron. He came over. His wife actually had it, and he stayed up under her. And then he came, you know, after, you know, when I found out I had it and I couldn't walk, he came over here to help her out with me, and he never caught it. So it's definitely what they're saying is definitely something going on within the blood types that how it affects the ones who catch it and how they heal and recover from it.
And so the safest thing we can do is put a mask on it, social distancing. I want to thank each of my guests tonight. I really appreciate you all. And I'm hoping that you all somehow or another can connect and continue to support each other through this journey, because I think it's important that you build a community and have that community of support as you continue to heal. Thank you all, Tuesday Together Talk listening audience, viewing audience. I so appreciate you all hanging in here for this very important conversation. Encourage your loved ones, encourage your friends to mask up and to practice physical distancing. Again, I'm Reverend Rebecca Burrow. You can always find me on Facebook at Reconciliation and Equity, or you can find me at www.reconciliationandequity.com. Feel free to follow us on Instagram as well. We will make sure that this video is made available for you. Share it. I know that the conversation is heavy, but it's an important conversation. It's important for people to know. So make sure that you share the video. Feel free to come back to the page whenever you feel like it. And we would be more than happy for you to have access to this video so that you can help us spread the word and make people aware. Thank you all so much. I appreciate you. God bless you all. And we are going to continue to pray that as a country, as a nation, as a world, that we get better. Thank you, Karen. Thank you, Rosalind and Paula, and so many others that have left comments this evening. Thank you so much, and God bless you.
Thank you.